Today we're going to talk about sickle scalers. We're going to start with the NEVI 1 on the maxillary anterior teeth. Remember, the first step is to think of your position, then your patient position. Remember your light and bracket tray and the use of your mirror. The first thing we're going to talk about is your grasp. Make sure your grasp is light. The index and thumb are across from each other but do not touch. Maintain the space between the two. The index and middle finger are on the same plane of the instrument. Your ring finger is going to advance ahead of the other fingers to support the instrument and hand. The ring finger advances ahead of other fingers to support the hand and instrument. The side of the middle finger rests on the side of the ring or on top of it. If it rests on top of it, this is called piggybacking. All fingers work as one unit and they touch each other. There should be no space between the fingers. The handle of the instrument should be between the second and third knuckle, but never more forward. Always make sure you maintain a neutral wrist in your grasp. That is not a neutral wrist. That is a neutral wrist. Now place your fulcrum on a tooth adjacent to the one you're working on. It should be firm on a dry, stable surface, and generally we will be using intraoral fulcrums. You will adapt the instrument initially at the midline of the tooth, about 1 to 2 millimeters away from the gingival margin. The working end should be directed toward the surface you're going to be scaling. The handle should be parallel to the long axis of the tooth. To adapt the lower 1/3 to the midline of the tooth, you may need to do a slight tilt. The angulation of the cutting edge should be 70 to 80 degrees to the tooth surface. For activation of the instrument, use short overlapping strokes. Cover half the interproximal surface when you get to it. The strokes are generally vertical direction, and you're going to use a wrist rocking or rotating strokes. Keep the lower 1/3 adapted to the tooth at all times. You will be pivoting on your fulcrum to accommodate this. And you will be doing some slight rolling of the instrument between your fingers, maintaining that space between your thumb and your index finger. The lateral pressure you use should only be on the pull stroke. Do not use any lateral pressure as you go down the tooth. The lateral pressure is directional. In this area, it is with your thumb into the tooth for lateral pressure. Pivot on your fulcrum and roll the instrument to keep the lower 1/3 adapted to the tooth. To do the other half of the tooth, you will change your patient position. Point the tip in the direction you are going. Repeat the same steps. Short overlapping strokes, wrist rotation or rocking, maintain a neutral wrist. Start at the midline, overlap your strokes, short overlapping, keep the lower 1/3 adapted to the tooth, maintain 70 to 80 degree angle as you go into the interproximal. Then you can move to the next tooth if you're repeating the same direction. Maintain that neutral wrist. Lateral pressure is only on the activation part of the stroke. For the left-handed student, notice the grasp. There's still a space between the thumb and the index finger. All the fingers are touching. The middle finger is in contact with the index finger and the fulcrum finger. Place your fulcrum down on the tooth, and we're going to start with the sickle. Initial placement is at the midline of the tooth.
Good.
Short overlapping strokes. Start 1 or 2 millimeters away from the tooth. Keep the lower 1/3 adapted to the tooth. Maintain 70 to 80 degree angle. And as you go around the interproximal, cover half the interproximal and keep the lower 1/3 always in contact with the tooth. Make sure you also do wrist activation and not digital. If you were to do the other side of the tooth, the end always points in the direction you're going. You'll start at midline again. Short overlapping strokes. Keep the lower 1/3 adapted to the tooth. Wrist rotating or rocking activation. Cover half the interproximal. We've now reviewed the use of the SickleScaler for both right and left-handed students.